A good afternoon. Welcome to yet another edition of Brothers in Cooperation, a program that brings to you development work, stories of friendship, stories of love, passion, and a determination to develop others or have other people's lives change positively. Those of you who read the New Vision might be familiar with this weekly, it's not an editorial, it's a column. By a friend in Canada, and he writes it later to a friend. I was impressed to read about a lady who started education, and she led a very humble life. She was taken into the Chiga cultures, but that is simply because she dedicated all her life to the Bachiga. Today, in that humble house where she was and where she lived, after fighting for the education of a girl child, but also education of the Bachiga generally, there is a university. Then there was another man who was neighboring this lady, who built a beautiful house, a mansion. It had all these glasses. All the Bachiga would go and spectate. And if I'm talking about Bachiga, you know Bachiga today, but I'm talking about Bachiga of 1930-something. They would go and spectate. But long after that gentleman died, I'm sorry I don't know, for lack of a better word, but human waste is what you find in that house. All the window panes when that person died were stolen. But the humble house where this lady lived, but she left a seed of education, of developing people, is still there. Those are the stories we are going to talk about today. Not in Bachiga, but we are talking about northern Uganda. We'll talk about Karamoja, but mostly we are going to focus on Gulu and the Acholi region, and the person or the persons or the people who lay the seed that we'll talk about today, that will continue, that will not be stolen away, among other people, the Cortis. I'm happy and privileged to be hosting today the daughter of the Cortis, and she is the president of the Corti Foundation. Welcome. Thank you. I'm sure when people meet you, talk to you like you were an angel yourself, I think based on the sacrifice that your parents gave.
They did all their lives here in Uganda, so well known in the north.
I would be happy to come back and get to hear more about the Corti Foundation. I am also privileged to host Dr. Odong Emintone, the director of Lacor Hospital. Welcome.
Thank you, Sarah. I'm glad to be here.
Yeah, I know Lacor Hospital has done a lot, particularly during the 2-decade civil war, during the Ebola outbreak, and I'm sure you keep meeting people talking about Dr. Dr. Lokuya.
Yes, please.
So I would like to, even before the program, commend the good work that you're doing. Also, on my left, I have Father Damiano. Excellent. I don't know if I should try the other name, Guzete.
Good attempt. Perfect.
He's from the Comboni Missionary. Welcome.
Thank you very much.
It is wonderful to know that there are people who, even when we thought the North was isolated, took concern in the North and interest since, I think, before independence, much earlier, even before we even ever thought of independence. Exactly. Those and more other stories we'll be hearing today. I think I should start with you, Father Damiano.
Yes.
I'm interested to understand how we know that you came much earlier. I'm not sure, because I learned that in 1857,
yes,
we had Lacor Hospital built, but that was also through the Comboni Missionary. And then we do not have a proper link on how much family you were in Uganda. Why is that?
So we have to go back a bit in history and connect to the middle of 18th century, when the revival, the missionary revival, started in Europe. Of course, everybody was looking for the sources of the Nile. We have to think about that in 50 years' time, about 500 explorers lost their lives looking, tracing back the sources of the Nile. And of course, together with the explorers, also missionaries came along, because they were reporting back that in Central Africa they were living about 100 million people at that time.
We had that population then?
Yes, they were surprised. I mean, they were more or less counting by seeing. So that was like an appeal for the Catholic Church and also for the Protestant churches to go and to take the gospel to these people. and also to fight the slavery which was rampant at that time. So we have some key moments in history. The first one is to be connected to Gregory the 16th, the Pope Gregory the 16th, that in April 1846 he established the Vicariate of Central Africa. You have to think about a very huge area which was comprising the Sudan of today, Uganda, Kenya, Tanzania, Central Africa, a part of RDC Congo as well. So it was a huge territory that was unexplored, and with all this population living in it. Of course, the Pope sent at the beginning a group of 5 missionaries from different nationalities, but due to the difficulties, due to the hardships of the environment and the sickness that they were taking, soon after they had to withdraw all of them. But they managed to establish a station in Khartoum. That was the mother mission for all the Central Africa. Of course, among this group, the second group that came afterwards, there was also our founder, Saint Daniel Comboni. He was a young man, very willing to do his apostolates among the African people, and soon after 2 years, he again got sick and he had to go back to Italy. That was a providential moment, because at that time, while he was praying, of course, he went to Rome, he went to look for support, both material and personnel, and while he was praying in Rome in 1864, he had an inspiration from above. He always quotes this charismatic moment of his life, and from that moment onwards, he dedicated all his life for the cause of the African people, to free them from slavery and to bring them the gospel. And his dream was to reach Uganda, of course. But of course, in 1881, he died.
Don't tell me he died before reaching Uganda.
Yes, he
died. Oh, that's sad.
It will be only afterwards, at around 1900, that his successors were the ones who reached Uganda. That was Monsignor Rioveggio, who had to apply to the then administration, British administration, and he got permission. But when they reached the border, they were stopped for 4 days.
By who now?
By the DC of that time, the British administrator. He prevented them from entering to Uganda. And after 4 days, via telegraph, it was the first telegraph that they got at that time, it was already working, they got the okay, so they could enter. They stopped at a certain place called Koba, and there it was the beginning of the missionary activity. Of course, immediately their work was to look after sick people, to education towards education, and all these things that the missionaries do at the beginning as they reach a place. People welcomed them. Even the local chiefs were very friendly to them, and they were even hosted at the house of the chief at that time.
Oh, that's great. I'm sorry to drag you back in history, but I'm curious. It's a very moving story. Why? Because he died in 1881. We did not have contact, at least formal relationship as Ugandans with the British until around 1884. So why then, who was preventing the founding father of Comboni missionaries from entering inside? Were there other related hazards or something?
Of course, we have to remember that those were Catholic missionaries. The British administration were from Church of England church. And that was somehow what prevented, were a bit suspicious that they would come and start competition with the local missionaries of the Church of Uganda as well. So they were a bit precautious on that side. But then seeing the vast amount of work to be carried out, they let them enter.
Because the British were never in the north anyway, were they? In terms of setting their strong systems of administration and infrastructure.
Well, in 1904 they were there.
But that is long after.
Yes.
You had access?
Comboni died in 1881. Then we had the revolution of the Mahdi, so everything was stopped. The missionary activity resumed after the Mahdi revolution in 1900. So from 1900 onwards, they started the work of evangelization again in Uganda.
Comboni missionaries, they tend to focus more towards health and education. Was that also from the founding director?
Of course, you cannot just announce the gospel without showing something connected to it. Human promotion is strictly connected to evangelization. And we have always been carrying out this kind of missionary activity wherever we have been sent. It is our pedigree, I would say.
I'm sorry, this is also a bit, I'm being a bit curious, and I hope not straying you from line, but H.M. Stanley in his book writes that when he came to Uganda, he found over 50 doctors who would operate, who would deliver women. Does the first people, is there any literature that Ugandans could find out, especially in as far as our indigenous knowledge in medicine and how people used to operate that time is when it comes to the Comboni missionaries? Do you have that literature?
Of course, the Comboni mission is immediately aimed at preparing local personnel. The motto of Comboni was "Save Africa with Africa." This is the...
Even way before?
Yes.
That's
when
interesting.
he got inspired in Rome in 1864, he made the plan for evangelization, and he said that the Africans have to be their own evangelizers. Since at that time, for Europeans, it was difficult to stay for a long time in these places because they were getting sick. The facilities were not yet there, like medicines and so on. So he planned to take Africans on the borderline to Egypt to prepare them to be sent afterwards back to the Central Africa. Of course, connections were there meantime. He did the journey through the desert for 7 times because he had to go back to Europe, do missionary animation, then come back and follow up the missionary activity and the missions, which were slowly growing at that time.
So do you have an idea of how advanced or unadvanced we were in terms of health, in terms of organization, particularly in the north? Because the other problem that we have as Africans, Ugandans as well, is the documentation of our history. And these structures, say the missionaries have been there, and maybe those are the areas we need to look at if we have to borrow from our history and document it and from our perspective. So I'm just curious to know, because as missionaries, at least, you related and interacted with the communities and people.
Yes, of course, we can have sources from the diaries that the missionaries were writing at that time, even though, of course, they have not been fully documented to the moment. But they speak about this collaboration and this interest by the local people towards development and upbringing the lifestyle of the people as well.
I'm interested to know the genesis of Lacor Hospital, because it's one of those hospitals that have sustained their service to the people from the onset. Yes,
we have to think that together with the missionaries we are coming also sisters. Women, sister, of course. And Comboni was one of the pioneers who brought down women to do missionary activity, sisters, consecrated women. And of course, the women were mainly taking care of the health side and the education of the girls. And they were always starting with a small dispensary. This is how things start, in a very simple way. I mean, they were just a little bit trained how to take care of wounds and small sicknesses, and then everything was added on. Of course, it was in the mind of the bishops at that time, in each diocese which was established, to have their own hospital. That was a priority. And if we look in the north, we have a serial of hospitals founded by the missionaries. Of course, afterwards, the missionaries left a bit, withdrew a bit, because they had to leave their specialized people to persons more fit for that work, to doctors, nurses, qualified nurses. And also they established from the beginning the schools where the nurses were trained in these hospitals.
Thank you very much. That's very interesting history. I'm sorry, but it's so rich that I had to divert you towards documenting and all that, but I'll come back to you. Now that you've talked about the giving it to the specialized people, I'd like to talk to a specialized person, Dr. Odong Emintone. Again, welcome. It is almost impossible for someone to talk about Lacor Hospital without talking about the Cortis. But before I go to the Cortis and Lacor Hospital, I'd like to understand now, what is Lacor Hospital? Is it a public hospital, a missionary hospital, a private hospital? What is Lacor Hospital?
Thank you very much, Chara. Lacor Hospital, according to the Uganda hospital policy, is categorized as a general hospital. That means it's not a regional referral hospital like classification, and it's not a national referral hospital, but a general hospital. It is also not really private for profit, but it's a private non-profit. That means it's like a charity organization. That's what Lacor is.
So how does Lacor survive?
Well, that's a good question, Sarah. I think it dates back to why the hospital was started.
And why was it started?
Father Damiano has just explained to you the missionary revival. And I think these missionaries are the visions. Vision of only not bringing religion to the local people, but also uplifting their lifestyles. That's why they introduced education, and in particular health. And the people at that time were very poor and really had nothing, and they were dying of very, very many diseases. And the reason of starting the hospital, I imagine, was really to save the life of the local people. And that's the reason why we still exist up to now.
Okay. Well, good work you've done. I was reading much earlier, and I saw that you treat about 3,000 people. I'm not sure if it's every day or every week. Is it every day 3,000 people come are treated at Lacor Hospital?
Well, in a year, a total of 310,000.
Oh, okay, so it's in a year.
310,000 people are treated in the hospital. And in a day, we see about 1,500, including the one in the inpatient, and plus the one who come as outpatient, and they go back after they have received treatment.
That is a huge, huge turnover. How do you manage in terms of staffing, in terms of drugs, considering you are a not-for-profit?
Well, it's a big hospital. Let me tell you that we have up to 600 staff who run the hospital. And the total hospital capacity is actually 554 beds.
Five?
Because
5,000, you say?
554 beds in the hospital. We have the main hospital, which is 482 beds. But we have also 3 other health centers, which is attached to the hospital. It's run by the hospital. It's a unique situation in Uganda because most health centers are not run by hospitals. But this is because of the vision of the founders, like Dr. Corti and his wife, who thought that although facility-based treatment would be good enough, but still many people stay in the rural area. 80 to 90 percent of the population stay in the rural area. So at the beginning, they thought of opening peripheral health centers. And these are the peripheral health centers I'm talking about. They're about 30, 40 kilometers from the hospital, which is in town.
Oh, I see.
And the total bed capacity of all those 554.
Doctor, I'm really sorry if I seem like bent on finding out about funding, but the issue of funding, especially when it comes to health services, is a challenge. You are operating in an area where they've had a 2-decade civil war, so even in terms of meeting government halfway or meeting this not-for-profit hospital halfway, there is a challenge. That's why for me, it's incredible because I have been to Lacor Hospital. The services you offer, even in terms of delivery, because you could offer service by availing in theory, but in terms of delivery and the relationship the hospital has with the community, that requires commitment, yes, but it also requires funding and resources.
Exactly, Sarah. I think that is an area which I would say is a challenge for everybody. I think money is never enough. If you want to know how our money come in, I would tell you that most of our funding actually still come from foreign donors. And a A bit of it comes from government of Uganda, about 13%. And we charge little fees, which contributes about 18% of the running costs. That means we have to borrow and beg for money from abroad. And we're grateful that we have the president of Corti Foundation, which is the key person which is helping the hospital in this area.
In fundraising?
In fundraising.
Okay, we'll find out more about fundraising later. I was meant to understand that Lacor Hospital, that's the impression I got. I'm not sure I read it somewhere, but it's a referral hospital when it comes to cancer. Is that the case?
Well, it's not a referral hospital for cancer. It's not true. But in the past, we used to treat cancer in the hospital until 1985, I think, because we had radiotherapy established in 1975, and it was the only radiotherapy in the country. So it was serving people in Uganda as well as people coming from Kenya and the neighboring countries. Unfortunately, this is radioactive, and it runs down with time. So since 1985, we have not been able to treat cancer by using radiotherapy. What we're doing now is to try to treat some specific cancers, especially cancer in children, and some few cancers which we think cannot come to Malawi, where there is the National Cancer Institute.
Is cancer that rampant in the north?
Cancer is very common, and it's becoming more common.
So, because there's a tendency to relate it to lifestyle. Is the lifestyle in the north such a lifestyle that leads to cancer?
I would not relate cancer only to lifestyle. But if you talk about non-communicable diseases, yes, cancer is one of them. But not all cancers come because of lifestyle. Many cancers come because of infection, actually. For example, the commonest cancer we see in Gulu and also in the country is cancer of the cervix. And the cancer of the cervix is somehow related to infection. Likewise, we have other cancers of the liver, for example, which is quite common as well. This cancer, again, is related to infection. We have cancer which is associated with HIV infection, like cancer of the skin, for example, commonly referred to as Kaposi sarcoma. But some cancers are definitely related to lifestyle.
Thank you very much. Today, I'm sorry, because we are talking about milestones of the Italian history in Uganda. But when you have a doctor, you can't resist the temptation to go and try to find out a little more about health. It is almost impossible to talk to Dominique Corti for like 5 or 3 minutes. You talk to her, especially what right now I want to people, my audience, to hear about, which is the history first before we go to the foundation of how your mother and your father, interesting how they found each other, interesting how she came and joined him later, 2 years later. It's touching. You want to write a novel, but still, I'd like you to. I'm sorry they're not there here, but
my father was an Italian pediatrician, and my mother was a Canadian surgeon. And they had met while they were both doing postgraduate in Canada. And both had always had the dream of going to work in a place where the people really needed, where they were really, really needed. So my dad came from a well-off family in Italy and decided to sort of tour Africa, because he had already a Jesuit brother who was missionary in Chad. He had friends in Kenya, in Rwanda. He had the husband of his sister was a doctor in India. So he went and looked for places where he would really be useful as a doctor. And he reached Gulu because the bishop at the time was an Italian Comboni. He had met in Italy, and they'd spoken to each other, and the bishop said, well, if you're looking for a hospital, I'm looking for a doctor because we've just founded a hospital a couple of years ago.
Wow.
Come and see.
Yeah.
So he came and he found that the place was really, really nice, and he found the situation was how he wished it. That is, he wanted to come and to be able to not to depend upon the mission for money. So he said, I'm going to look for it myself, but in exchange I want to be able to really develop myself. Because the dream right from the beginning was to offer the best possible healthcare to the greatest number of people at the lowest possible cost. So he went back to Italy and started preparing the first expedition of material, and received a postcard from my mom, who was doing internship in France. And so he said, I'm leaving for Uganda, but I have no surgical competences. Let's see if I can go and convince this beautiful young lady to come and work for a few months and start off the surgical part. So he went, and she agreed to go for a couple of months. So he said, I'll pay you your ticket and cigarettes, but that's all.
Ticket was then ship ticket?
No, it was plane. It was, at the time, it was a military plane. There were Italian military Air Force missions, I think UN missions to the Congo. And so they allowed to put some people and some equipment for the hospital at the time.
Interesting.
And so they arrived, and if I'm here to tell the story, it means they didn't go away after 2 months. Yeah,
amazing how much work they did. She joined him after 2 years?
Well, he'd been here in 1959 as an exploratory tour, in 1960, I believe. And then they both arrived in 1961, in April 61. And they married a few months later in the Comboni sisters' chapel in the hospital, and I was born always in the hospital 1 year later.
In that hospital?
I was born and I grew up in Lacor Hospital.
Incredible. I'm happy you...
So I was there before Dr. Odong, even if he's been there for many, many years.
Yeah. Okay, I'm sure my audience is going to be upset with me for calling for a break, because this is not a story people would like to have interrupted. But for now, the more reason you should not go away. We'll go for a break, make some money, come back, and we'll hear more about the Cortis and other things, the Comboni missionaries and the mission itself, and also Lacor Hospital. Don't go away, stay with us. Welcome back from the break. Before the break, we were talking about Dr. Corti. The Cortis, they're all doctors. Are you a doctor?
Yes.
Oh, so medicine runs in the blood.
Yes.
You have other siblings?
No, unfortunately, I'm a single child.
Fortunately, you had all the attention.
Yeah, fortunately, I was single child, so I managed to grow up inside the hospital. Very privileged. Induction from a young age.
That's good to hear. I still wanted to hear a little bit more about your father and mother, because it's a very touching story, but I also want to hear about the Corti Foundation. I must say that when I saw you the first time, I saw your mother, because I just saw her in the picture. I always love this story. Your father was not lying when he said, I want this beautiful lady to join me. Yes. So you really look like her. So is she the one, because they were both doctors, they both committed, who of them, how did they complement each other, and who of them do you take after in terms of executing medicine or projects?
Well, he was very good at organizing and finding people. He was a pediatrician himself, but through the 40 years he stayed at Lacor Hospital, he went more and more into organizing the hospital, looking for funds, looking for the way to make the hospital run better and better. Well, she was the one really not only working as a surgeon, but in outpatient, and really training the young doctors, both the foreigners who came and the Ugandans, when the hospital was approved as internship center for Mulago in 1983. And so they were a team. They were always talking about, you know, after hours, supper, lunch, evening, weekends, holidays. It was practically the only topic was the hospital and the problems with the patients, the clinical problems, the organization problems, the funding problems, and writing letters and going to visit, you know, organizations to get help for their hospital.
With the kind of work they did, it's amazing they managed to get you, because Lacor Hospital is a big baby, eh? It's like thousands of babies.
My mom used to say is my elder brother.
Oh, that's touching. So tell me, what do you yourself do in terms of medical, because you're a doctor? Are you a surgeon?
No, I'm nothing, because when I got my medical degree, actually the hospital was already a large hospital, and there were many Ugandan doctors that were really, really good, and I really wouldn't have been able to contribute as much as I contribute by trying to find the funds, because I did my training in Italy, and by the time I finished my training, my parents had set up this foundation, because they in the 80s the hospital was really growing, and 80s and 90s really growing to try and respond to the need of the health by the population. And the funding, the people were in the middle of a conflict and getting poorer and poorer, so it was obvious that we would have to get more money in the future. And especially during the 80s and 90s, the big international funding organizations were going more and more for their own set of priorities, which were often not the hospital's priorities. The hospital was always trying to understand what the real priority needs of the population were. And for example, funding of running costs and funding of salaries was almost a bad word 20 years ago. People would say, no, 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 I will not fund salaries. I'll fund an equipment or a new building. But, you know, so they decided to set up a funding organization and try and pick it up so that it could manage to really help the hospital in the aspect of running cost, which it was by far a huge priority. And it was obvious right the day after I got my degree that if I really wanted to help Lacor Hospital, was not in being a doctor in Lacor Hospital, because they were already there and very, very good. But I could really help in trying to develop this fundraising.
So the foundation is the Corti Foundation.
Yeah.
So how is it set up structure-wise?
Well, it's set up, it was founded in 1993 by my parents. And of course, Italy had already always been the place from where the help was coming, the money, most of the money they were looking for, they would look for it in Italy. Initially, when in the 60s, the hospital was small, so they would go around begging from, you know, brothers, sisters, uncles, cousins, friends, relatives, whatever. And then they started getting more into asking big organizations. And also, for example, doctors. Until 1983, we had a nursing school founded in 1973, but no Ugandan doctors. So the doctors would come from Italy, and it was young doctors from Italy coming for helping for 2 years, for 1 year, 2 years. So the foundation in Italy was set up relatively recently in 1993-94, but it had capitalized on 40 years of family and friends and other organizations. So we started from there, and we do it very, very quietly. I mean, the hospital has built itself a reputation in 50 years of really not so much as an image. They usually say, when we study your organization, your hospital, you have almost no image, but you have an impressive organization behind it and an amazing output. So it's the quality of the work that is done and the amount of work that is done. So we've tried to build our foundation in the same way. So we don't. We try and cost as little as possible as an organization, and we go door to door, because we need to find especially the donations that are going to be free. You know, they're not going to say, okay, I give you this money, but you have to buy an equipment with it. No, because I don't know ahead of time what the hospital is going to need it for. The hospital continues to look for projects, but these projects are usually very specific. So we fill in the holes in between so that the activity continues.
Conditions. There is a lift to borrow, because why do you commit to buying equipment or certain drugs, not knowing what your community, what your society, what your patients will need? And this applies to even other sectors, roads and whatever it is. You go for funding or grants and you commit to buying certain things, not knowing whether or not you will. That takes me back to, yes, Italy has always been where you've been getting funding from the genesis. What is it like now? Do you succeed in getting money elsewhere?
My parents created also another foundation in Canada, because my mother was
I was about
Canadian.
to ask,
yes.
how about Canada? Yeah.
Because my mother was Canadian. Unfortunately, Canada was very far away from the hospital, geographically, and also because my mother came from a poorer family, so she was the only child who had studied, gone to university. The family couldn't help as my father's family had helped, and it came rather more easily to base all the fundraising and help throughout the history in Italy rather than in Canada. But by the year 2003, 2004, in the Italian Foundation, we picked up, and we had an office working, and so we said, why don't we try? We've already got activity going on, like newsletters. It would cost very little just to translate them in French and in English, and try and see if we can get the Canadian Foundation to pick up and to bring this other parent of the hospital within the picture to help.
I know. Yeah. So what has been the response?
Well, it's picking up. It's very different from Italy and extremely different from Uganda.
Yeah, isn't it quite limiting in a sense to decide to focus on the areas where the parents, the founding people are from? Italy, maybe Canada, Uganda. What happens to all these issues they're talking about internationally, Millennium Development Goals, health, maternal mortality, and Lacor Hospital is dealing with all that and more?
Well, we don't fundraise for these specific things. I never fundraise for, I don't say, give me the money to buy this drug.
Yeah.
The child doesn't come to the hospital. These sick children and people don't come to the hospital with written here, I have malaria.
Yeah.
They come with a huge amount of problems. They usually don't have a single problem, but many.
Yeah.
So it is the whole hospital that the patient needs to go on. So I refuse to do fundraising for a specific thing. The people need to understand that you have to give us the money and we will use it. I'm not saying that you have to have confidence and not follow up on how we use it. That's extremely important to give back in terms of the hospital keeping onto its strategic plan, keeping onto its mission, keeping its performance, having a thoroughly transparent way. We've been doing meetings these last few days because we as a board, we really try and continuously improve on our system so that we really know how the money is being used, how well it's being used, and we try and be extremely flexible in being able to change if the need arises. If the health needs of the population changes, you can't keep on offering a certain kind of treatment if the people need something else. But you have to be able to do it flexibly and keep being extremely transparent with everything you're doing so that you show that it's being used as best as possible in the most efficient way.
Do you know if the hospital in itself is trying to find private sources of income, like targeting certain things?
Well, the hospital continues to look for funding, especially with the international organizations. There are currently quite a few other organizations that help, and there are always new trials to find someone new, because we've been living in a conflict for 20 years. And so the situation has really changed dramatically in the last few years. We had a lot of NGOs there to whom we could ask money for emergency, and now they've all gone away. So this is the difficulty, and up to 60–70% of the population is still living in a desperate extreme poverty. The war is finished, but it doesn't mean that within a year you're going to pick up again. Of course, maybe Dr. Odong can really explain what all this.
But before that, I would like to, because I'm glad you were talking about the meetings you've been having, because that's what I wanted to ask also, because the health sector generally is dogged with all these issues of accountability, transparency, and when you give this money, what are the chances that it's going to be actually applied to where it is said to be? What is the monitoring system?
I'll leave that for Mr. Odong to I say
what
Mr.
do
because
you
he's
do?
a surgeon.
I will go back to him, but what do you do to ensure, as a person who goes and mobilizes this money? Because half the time it's also about government usually leaves the accountability. It's like, okay, because they limit themselves to their area of intervention. And then the donors are also like, okay, there's other people who are monitoring, so then there is a gap.
We have refused the idea of, I speak as foundation, giving money to the hospital. We have refused the idea of setting up a system of controlling how the money is used. Because if an organization is big like Lacor Hospital and has many other organizations helping, and each of these 10, 15, 20, 50, they all have their own systems of wanting to check. It's a huge amount of money that is thrown into external controlling, while instead everything should go into trying to get the hospital to get its own systems really working, and then you go and control the systems once they're approved. You don't waste money and people and time and money to put other control mechanisms. You have to develop the hospital's own. So it's the hospital audits. The hospital, now I'm talking as a board, we have systems going on and continuous improvement of how we check and control and have financial audits and have clinical audits, internal and external. So we have external people being invited to come in and to go through the controlling system. And as a donor, as foundation, that's what I want. Not to have many organizations wasting a lot of money on each of them on their own systems, but to make such a very good system for the hospital, which is what the hospital needs. So it's answering to the own hospital's priority needs.
How is the hospital system like?
Over to you.
To you, what do you think of the system?
I think it's wonderful, but it's where I was born, so maybe I'm a bit biased.
How does the system work?
Well, Sarah, to add on to what Dr. Dominique has said, we as managers of Lacor Hospital, we know that our life and the life of the hospital and the life of millions of our patients we treat really relies on our being transparent and accountable. And that's why we have set up systems, administrative system, which is quite transparent. I guess we actually learned from the founders of the hospital. And I'm glad to say that our core values still actually, we owe it to the founders like Dr. Corti and his wife, and later on Dr. Lacor who came in. And we are very transparent. And the governance, in terms of the Board of Governors, headed by His Grace the Archbishop of Gulu, is very helpful and really guide management in all areas, including accountability and transparency.
Okay, thank you very much. I'll come back. I also think that in terms of accountability, as much as there needs to be a system, there also needs to be a community or people who should also be able to demand or expect certain services, which to me seems the situation a bit in Gulu. I don't know, I think it's the history the people, or the actually people have had with Lacor Hospital or with the founding directors, with the Cortis, because there's a way in which there are certain expectations that the actually people, maybe there are other people living in that region, I'm talking about the actually they are the ones I've related with, the expectations they have or from Lacor or of Lacor, and they don't expect less. That is good. That could be a credit, because then there's a sense of trust, but it is also a challenge in terms of meeting that that expectancy. I'd like to invite an interview from a recorded interview from CFI, who are also partners of the Corti Foundation. Studio, please.
The name is CFI, Centro Formazione Interazionista. Is a group of consultants in organizational psychology who work with organizations, institutions and agencies of profit and no profit with different dimensions. Our vision, our mission is to help organizations in focusing on their organization and human resources. So we try to be tools in the hand of our clients. Our main topics or areas of intervention can be summarized as human resources management, training in different topics regarding the human resources, role construction, and structuring of the organization. Our interface is necessary in order to translate in some way or make more effective the cultural background that guides who writes the projects and the cultural background of the people and the context in which that project should be applied.
We had the chance, I think more than 2 years ago now, to be involved in the biggest restructuration of the Lacor hospital. Probably the biggest aim of the new Lacor project was to prepare the hospital for the challenges of the future, particularly related with the new management of the hospital and the new Ugandan management of the hospital, of course. What we did here was a first step of analysis of the system with interviews, focus group. We spent a lot of time analyzing the workflow, the work processes, the decision-making processes of the managers and so on. So the biggest work we did was to helping the people preparing a sustainable meaning for these words, and we did this through different action on different levels, like a training course in which we provide the managers with skills like leadership, conflict management, effective communication, change in the organizational matrix, like the tools and that the manager could actually use to implement what they were expected to do, and also we provide them with a few strategic advices in effective communication. And a particular feature of our intervention is that we keep the relationship with the person we are working with frequent follow-up that are actually more a supervision of what is occurring, what is happening.
Welcome back. Well, that interview has sort of like taken me another direction. Am I seeing new management?
Yes, Sarah, I think I want to take you back since 1983, and also to remind you that the founder of the hospital, Dr. Corti and Dr. Lucille, knew for sure that one time this hospital will be run by the indigenous. In that sense, they established the nurse training school in 1973. And their vision was that these nurses, remember Father was telling you that it was the Italian nuns who started the hospital as a dispensary. And then when the Corti came, they knew for sure this is very important to develop the locals to run the hospital in the future. Later on in 1983, they started what is called Africanization of the hospital by admitting the first African doctors in the names of Dr. Matthew Lukuya and Dr. Izati Isaac, who is now the Director Planning at the Ministry of Health. Dr. Matthew Lukuya unfortunately died in the year 2000 of Ebola. But this process continued of Africanizing the hospital. And what he was talking about was the process of really developing or training managers, but he was referring mainly to middle managers, including the ward in charges. Remember, a big hospital of the church size cannot only be managed independently by the top management. So we needed to develop these middle managers. And exactly what he was doing was to train the middle managers in the form of in charges, ward in charges. So this new management is a transition from the Cortis who have left us into African managers.
Okay, thank you very much. I'm also a bit curious, briefly, about the challenges of the future, because Dominique here was telling me, I don't know what my patient will tell me, I don't know what they will need in the future, I don't know. And then now, you are being trained for the new challenges.
Exactly, we have challenges now, and we have been having challenges.
Yeah, the new challenges are what? What do you expect to come up?
I think the one we think is going to be ongoing is financial sustainability. As the number of patients, the hospital has grown. The hospital now needs about 9 billion Uganda shillings in a year as running costs.
Oh my God.
And that's not a
That's
small
huge,
amount of money.
That's about, because the health budget is about how much? It's 9% of the total budget. Doesn't it get to close to 9 billion?
Well, that's ours. That is how big it is.
Oh my
So
God.
the biggest challenge is to continue getting this money. And as I told you, we rely mainly on donors. We are grateful for the government of Uganda giving us about 600 million in a year. We would like to see more involvement of government of Uganda, because the services we are delivering are not really private services. Although we are going to call private, not for profit, but the people we treat are the ordinary Ugandans, the poor Ugandans, who cannot afford health services. So that's the first challenge. The other challenge, of course, is the increasing cost of health service delivery, and then the expectation of the community. We have set up high standards. We really need to mend there. We don't need to calm down.
And good luck with that. I would wish that you remain there or get high. I would like to come back, because you are guilty for us being here, the Comboni, because we blame it on you that we have that big hospital. Anyway, I'm trying to say thank you, because it is that vision that we are here. I would like to understand how the role you continue playing and how related you are now with Lacor Hospital.
Well, the missionaries continue to be present in the hospital. We commit ourselves to giving personnel as far as spiritual help is concerned. We believe that in Africa, the person is healthy in a holistic way, not only under the point of view of body or psyche, but also spiritually. And we know that people do believe a lot that any disease comes from a spiritual root. So it is this delicate service that now we give to the patient to assist them to exorcise, I would use this word, that bad spirits, whatever it is, that causes the sickness. Of course, we need also the support of the medical people, of drugs and so on, but also this part I think is very important.
So what happens to people who are not Catholic? How do they benefit from that spiritual intervention?
That goes beyond denomination. I mean, when you speak to somebody and you speak to pray for whatever the person believes into, it is also always beneficial.
Quickly, please, what do you have to say, like in a minute, about time is not our best ally, about the role Lacor is playing, the Comboni missionaries, and the relationship between Italy and Uganda?
Well, of course, it is, as we see it now, it is the result of the dreams that our founder was having, because he sees that it is not anymore in the hands of the Comboni missionaries, as it was at the beginning, but it is run by, it is slowly taken over by African people. And if Comboni would come back now and see what has taken place in this amount of years, he would be really thrilled to see.
He left plenty of branches and seeds that sprout out.
Yes.
Thank you very much. It's been wonderful to have you here. I would like, I'm sorry I'm putting you in a position that you might not be comfortable with, but seeing as I do that you started a nursing training school, Lacor Hospital, I'd like you to comment about the recent discussions and debates that are coming into mainstream, that we do not need nursing assistants in a country where we have a ratio of 1 doctor to 20,000 patients.
Sarah, that is a difficult area to handle. We really are producing quite a number of nurses in this country. And if we are talking about standards, I understand why the Minister of Health would like to see our patients be handled by highly trained personnel. I would think if we had the means and we had the nurses, this would be the right direction to take. Unfortunately, if you go to the rural part of Uganda, we do not have these trained nurses. The health centers are actually being run by these so-called nursing assistants. What do you have to do if you have no alternative? That's my idea.
Thank you. I relate with that sentiment. I'd like to hear from you, Dominique, Corti. One final word about the vision your parents had, how it is blending in with what is happening in Uganda now, and well, the relationship Italians also have with Uganda.
We did an exercise a few years ago. We'd never had a strategic plan, and now it's going to end. The first 5-year strategic plan is going to end next year. But it's been a really interesting exercise because actually the hospital had been developed by my parents first and by those who followed. They had an implicit idea of where they wanted to go, what they wanted to do. But the hospital has really grown, and the size and the amount of people treated and the context has changed and was already changed a few years ago. So we tried to carry out this strategic plan. We tried to create it by involving not just the management, but by involving the whole staff of the hospital and representative of the community. And what came out was that the mission is maintained.
Yeah, I would like the viewers who are watching that is a movie about the Cortis, Dominique's parents, Dr. Corti, the husband and wife. Wonderful to have you here. Have a lovely weekend. Travel back safely to Gulu. And yes, stay tuned to WBS Television. I am Saran Sigai.
Thank you very much, Sarah.